Hello everyone, my name is Schneider Pierre, and along with group members Claire Pierre and Marlon Proenza, today we'll be presenting on TEAMSTEPPS and its global impact on patient safety and healthcare. As a team, we examine TEAMSTEPPS as an evidence-based patient safety practice and explore its impact on communication, teamwork, and clinical outcomes across different healthcare settings. Through this presentation, our goal is to provide a clear picture on how TEAMSTEPPS have improved patient safety and how it can be applied successfully in healthcare settings. While teamwork and effective communications are essential to patient safety and for optimal patient outcomes, historically they have continued to be major challenges in healthcare. According to many reports, medical errors account for tens of thousands of deaths each year, and research consistently shows that communication and teamwork failures contribute significantly to preventable harm in healthcare settings. The Institute of Medicine's 1999 report completely shifted the national focus toward improving safety systems at that time. In response, the Agency for Healthcare Research and Quality, together with the Department of Defense, developed TEAMSTEPPS as a structured, evidence-based program to improve teamwork behaviors and communication practices. TEAMSTEPPS is now considered the national standard for high-performance team training in healthcare, and its implementation has been shown to improve quality, efficiency, patient safety across different care settings. The purpose of this presentation is to analyze the significance, application, and impact of the TEAMSTEPPS framework as a patient safety practice. We'll review research that explains why communication failures continue to be a persistent problem and how TEAMSTEPPS have helped address these barriers using structures and standardized tools, which we will discuss later. We'll also look at the effectiveness of TEAMSTEPPS through current literature, including studies that report strong improvement in teamwork and patient outcomes, as well as studies showing mixed results. And lastly, most importantly, by integrating the literature, the goal of this project is to show the importance of TEAMSTEPPS as an evidence-based approach to improving communication, teamwork, and safety across healthcare settings. One of the biggest patient safety issues in healthcare is ineffective communication. According to research in long-term care settings, communication failures have been the leading cause of up to 89% of preventable adverse events. These preventable errors include medication errors, delayed or inappropriate intervention, and missed nursing care. The literature strongly supports the use of TEAMSTEPPS to mitigate these issues. Walker explains that tools such as SBAR, checkbacks, callouts, and structured handoffs have been used to implement smooth communication process that reduces opportunity for error. The study by Walker and colleagues shows that implementing TEAMSTEPPS in long-term care significantly improve communication between nurses and reduce the kinds of breakdowns that often lead to patient harms. Overall, the evidence is clear. Improving communication through standardized tools led to safer care environment. Reviewing the literature, we also found that the implementation of TEAMSTEPPS doesn't only lead to significant improvements in patient communication, but also major improvements in patient outcomes. A 2024 study by Shai et al. Reported several significant findings after implementing TEAMSTEPPS in a hospital system. The perioperative mortality rate dropped to 0.019%, which is very significant. Unscheduled reoperation decreased to 0.11%, and antibiotic prescription rate fell to 13.26%. Also, the staff reported that the TEAMSTEPPS training helped them better understand their role and improve their overall communication skills during patient care. So it is evident that these positive findings are the result of stronger communication, clearer role understanding, and more consistent use of safety procedures. These clinical outcomes prove how teamwork and communication improvements translate into better healthcare processes and patient safety. Other than promoting optimal patient outcomes, the literature also emphasizes that the implementation of TEAMSTEPS in healthcare settings can significantly enhance workflow and safety processes. One of the biggest improvements was seen in high risk processes such as blood transfusions and medication administration. A 2024 study showed that TeamSTEPPS training improved the quality of medical management and enhanced the efficiency of clinical workflows. The authors of the study reported that, as a result, care teams became more coordinated, more consistent in their communication pattern, and more reliable in the following safety procedures, such as medication administration and blood transfusion management. TeamSTEPPS enhances efficiency and coordination and decreases delay in interventions and care. In 2024, Elwin and colleagues studied the impacts of TeamSTEPPS training to newly graduated nurses during their transition into clinical practice. The study showed significant evidence on TeamSTEPPS' impact on teamwork and collaboration. The results revealed that the total patient safety culture score increased from about 98 to over 150 points immediately after the training. And these improvements continued beyond 2 months, which is impressive. As we can see, TeamSTEPPS had a strong positive impact on how these new nurses saw collaboration, communication, and patient safety. The TeamSTEPPS training also gave the new nurses more confidence, improved how they interacted with experienced staff, and helped create a safer work environment. Based on the literature, new nurses can benefit tremendously from having a structured framework for how to communicate and collaborate with other healthcare professionals. Although many of the studies that we found did show strong improvements in many domains with the implementation of TeamSTEPPS across different clinical settings, but not every implementation produced statistically significant results. A quasi-experimental study by Hassan et al. Examined the outcomes of modified TeamSTEPPS training programs for nurses. The results were mixed. Improvements were seen in communication attitudes and perception, but these changes were not statistically significant. And team communication behaviors in the hospitals did not show meaningful improvement. These mixed results might be due to the modification of the training programs. Most importantly, the literature consistently emphasized that implementation quality is essential for success. The mixed results showed that TeamSTEPPS is most effective when it is implemented consistently, reinforced over time, and supported by leadership. So, partial or modified versions of the program may not always achieve positive outcomes.
On this slide, we're looking at where we are today with the national implementation of TeamSTEPPS. TeamSTEPPS has evolved into a nationally recognized program that is fully supported by both the Agency of Healthcare and Quality and the Department of Defense. Across the country, more than 70% of U.S. hospitals have already integrated at least one TeamSTEPPS component into their practice. This widespread adoption highlights the program's value and its impact on improving teamwork and communication in healthcare settings. The core competencies of TeamSTEPPS, leadership, mutual support, situation monitoring, and communication, are now becoming embedded in daily clinical practice. These competencies serve as a foundation for building safer and more efficient healthcare teams. We also see that integration with electronic health records has strengthened structured communication tools such as SBAR and checkbacks, allowing teams to maintain clarity and consistency during patient care transitions. Finally, simulation training has played a major role in supporting TeamSTEPPS. By providing hands-on, realistic training, simulation promotes interprofessional collaboration and prepares teams for real-world challenges. Ultimately, enhancing patient safety and readiness. We highlight how essential team steps in anesthesia practice. As anesthesia providers, we work in environments that can shift rapidly, especially during induction, emergence, or unexpected crisis. Team steps provides the structure we need to coordinate efficiently and manage these high-stakes situations safely. One of the core benefits is closed-loop communication. This ensures that instructions are heard, repeated back, and confirmed, which minimizes misunderstandings during critical moments. Clear communication also strengthens our hands-off between the OR and the PACU teams, helping maintain continuity of care as the patient transitions between phases of anesthesia and recovery. Another major advantage is that reduction of medication errors of roadside procedures through standardized tools like checklists. These systems keep everyone aligned and reduce variability in practice. Finally, Team Steps promotes psychological safety. It encourages every team member, regardless of role and hierarchy, to speak up when something seems concerning. This culture of respect and open communication directly supports safer patient outcomes and more cohesive teamwork. On this slide, we highlight some of the current challenges and limitations that organizations face when trying to implement teamwork or communication based interventions. One major issue is inconsistent implementation across different departments and facilities, which makes it difficult to achieve uniform improvement. Additionally, when there is limited follow up training, the skills that teams gain tend to fade over time. High staff turnover also plays a significant role. When new team members constantly rotate in and out, it disrupts the culture and consistency needed for effective teamwork. We also have real world constraints, such as limited time and competing organizational priorities, which makes sustaining these initiatives challenging. Finally, there is often a lack of outcome based metrics, make it harder to evaluate long term effectiveness and justify continued investments. These limitations emphasize the need for structured reinforcement and better measurement strategies moving forward. Team Steps is moving towards a future that's much more dynamic and adaptive than early versions. The newest evolution, Team Steps 3.0, places a strong emphasis on continuous learning, real time feedback, and the ability to adjust teamwork behaviors as clinical situations change. Another major direction is the integration of AI driven simulation tools, which will allow teams to practice communication in realistic scenarios and immediately analyze their performance. We are also seeing team steps expand beyond traditional hospitals environments into ambulatory and telehealth settings, which is becoming increasingly important as healthcare continues shifting towards outpatient and virtual care. A key priority moving forward is strengthening diversity, equity, and inclusion within teamwork processes to support safer and more culturally responsive care. Overall, the goal is to build healthcare systems that are resilient and learning oriented, system that continues to evolve, grow, and improve the way teams work together.
TeamSteps was developed by the Department of Defense in 2001 and released to the public in 2006. The goal of TeamSteps was to decrease the amount of medical errors that was going on in the field at the time. It was very prominent. TeamSteps' goal was to improve teamwork and collaboration between various modalities in healthcare. Since it was released, it's become the industry standard. Prior to TeamSteps, interdepartment communication was very fragmented. What this means is that radiology would have their own mode of communicating, so would nurses and doctors. When these interprofessionals came to collaborate, not all the necessary information was transmitted in their communications. What this led to was an increased rate of errors and deaths of patients as a result. Other things that were different as well is that there was a hierarchy standard within the healthcare industry. Therefore, nurses and other individuals were not able to properly advocate for their patients. Also, operating room teams frequently didn't huddle prior to starting the day. What this led to is a lack of defined roles within the OR. In order to address the elevated medical error rate that was going on in the industry at the time, TEAMSTEPPS created 4 competencies. These 4 competencies are leadership, communication, situational monitoring, and mutual support. So leadership is basically the ability to ensure that the team is effective, have the resources they need, and the team's actions and goals are understood. Communication ensures that verbal and nonverbal communication is clear amongst team members. Situational monitoring is to reassess all the situations to gain situational awareness and support effective team functioning. Lastly, mutual support is for certain individuals to function such as pillars of knowledge for other individuals within the team so they can make sure each team member is knowledgeable about their task and their workload in order to facilitate role clarity within the team. TEAMSTEPPS is essentially a collection of tools utilized to accomplish the 4 competencies. And these 4 competencies, their goal is to promote effective communication as well as teamwork within the healthcare field. So a lot of these tools you guys may have heard of before. This includes SBAR, IPASS, CUS, I'm Safe checklist. So with the SBAR, you guys know it's situation, background, assessment, and recommendation. What this does is provide an effective transition of care between professionals without missing essential information. Essentially, the person giving the report knows what needs to be given, and the person receiving it knows what may be missing based off this standardized method of communication. The CUS tool is basically used to raise concerns that an individual may have. And because of the standardization of the tool, when someone uses this, they know there's a safety hazard that the person is very concerned about and therefore are likely to listen. TEAMSTEPPS has a wide reach within the healthcare field. Because of the versatility of the tools TEAMSTEPPS provides, it's applicable to many aspects of care within the healthcare industry. So therefore, TEAMSTEPPS has a wide range of stakeholders. Some of these stakeholders include anesthesia providers, surgeons, operating room nurses, post-operative care unit nurses, and hospital administrators. Anesthesia providers, they use TEAMSTEPPS when they lead during perioperative emergencies. Surgeons utilize closed-loop communication in order to facilitate effective teamwork within the operating room. Operating room nurses, they utilize timeouts and some of the tools such as CUS in order to voice concerns about a patient's safety. While utilizing these tools, individuals within the operating room team know that there's a serious concern that this person has and are likely to listen. Postoperative care unit nurses utilize SBAR in order to facilitate transition of care between anesthesia providers and themselves to other nurses within the organization. Hospital administrators enact policy change, and they provide training and ensure a smooth integration as well as effective leadership within the organization. Since implementing TEAMSTEPPS, medical errors have been drastically reduced due to a lack of miscommunication that was going on to the industry prior to its implementation. TEAMSTEPPS allows for leadership, effective communication, situational monitoring, and it supports daily workflows seen within many organizations around the world today. When it came to implementing TEAMSTEPPS, it had the added benefit of utilizing tools within the industry that were already pretty well established. So what this does is allows organizations to gain rapid adherence from those that are already familiar with the tools and those that aren't. Because individuals that would be normally resistant to change were less resistant because these tools were already well established. And individuals that were not familiar with the tool that would be implemented, they had others around them that were familiar with it. So what this allows is for the creation and maintenance of collaborative culture within an organization. There are many barriers when implementing TEAMSTEPPS, some of the most prominent being a lack of information sharing as well as a hierarchy culture. Additionally, A lack of role clarity, inconsistencies in team membership, as well as complacency in implementing team steps is a barrier. The various combinations of all of these barriers will lead to miscommunication as well as increased patient harm.
Communication breakdown continues to be one of the leading contributors to sentinel events across healthcare. These failures often stem from unclear messaging assumptions and gaps in shared understanding among team members. TEAMSTEPPS provide a structured approach to address these root causes by establishing tools and techniques that strengthen communication and reduce ambiguity. Its framework is grounded in human factor science and evidence-based teamwork principles, which helps teams anticipate, detect, and correct errors before they impact patient care. When these strategies are consistently applied, organizations have seen measurable reductions in adverse events and meaningful improvements in patient satisfaction. Overall, TEAMSTEPPS directly targets the communication vulnerabilities that place patients at risk. This slide highlights the core competencies that consistently drive team success. First, leadership ensures that resources are managed effectively and that team actions are well coordinated. Situation monitoring strengthens shared situational awareness, allowing team members to anticipate needs and identify issues early. Mutual support promotes workload sharing and enables peers to step in when others need assistance, which protects safety and efficiency. Effective communication, particularly through structured tools like SBAR and timely call outs, ensures that information is accurate, clear, and actionable. Finally, continuous feedback loops helps teams refine their performance over time, reinforcing improvement and maintaining high reliability. TEAMSTEPPS has consistently demonstrated measurable evidence-based improvement in patient safety and team performance. Research shows that 23-30% reduction in reported medical errors after implementation, highlighting how powerful structured communication can be in preventing adverse events. We also see nearly 40% improvement in perioperative handoff accuracy, which is critical in anesthesia where even small details can change clinical outcomes. Beyond patient metrics, TEAMSTEPPS significantly enhances staff engagement and overall job satisfaction, creating a more supportive and collaborative work culture. This leads directly to lower turnover and reduced burnout among anesthesia providers, an essential outcome as we continue to face staffing shortages and increased perioperative demands. Ultimately, these measurable results show that TEAMSTEPPS is not just a communication tool, it's a catalyst for safer care and healthier work environments. Sustaining teamwork initiatives in the OR can be challenging because several systemic barriers get in the way. Limited administrative support and funding make it difficult to maintain long-term efforts. Competing organizational priorities like EMR transitions and staffing shortages often push teamwork training aside. There are also inadequate tools to monitor behavior change and long-standing cultural hierarchies that affect communication. Finally, without protect time to team to train together, it becomes hard to reinforce and sustain these practices. In anesthesia, these findings really emphasize how critical structured communication is. Especially during pre-induction briefings, clear communication enhances team readiness and reduces variability in high-risk situations. It also strengthens coordination during crisis, allowing faster, more organized emergency responses. Another key implication is the value of thorough post-procedure debriefings, which help teams identify gaps and reinforce best practices. Overall, applying these principles improves collaboration between anesthesia providers, surgeons, and nurses, ultimately lowering the intraoperative complications and near-miss events. In summary, TEAMSTEPPS plays a transformative role in healthcare by turning teamwork into a structured, evidence-based approach that directly strengthens patient safety. It aligns closely with national patient safety goals and anesthesia care standards, making it a powerful framework not just for communication but for ensuring safer clinical outcomes. One of the biggest factors that determines whether TEAMSTEPPS truly works is leadership engagement. Consistent support from leaders is what sustains the culture and keeps the strategies active in everyday practice. Looking ahead, The long-term success of TeamSteps will rely on how well we integrate new technologies, promote inclusivity among all members of the care team, and achieve system-wide adoption so that these principles are embedded across the entire organization.
TeamSTEPPS is being applied to many modalities within healthcare. One study implemented TeamSTEPPS in order to address a sudden spike in adverse events they were experiencing. So, what they did was they empowered medical professionals like doctors and nurses to speak up when they identify a safety hazard. And the impact that this had was decreasing the adverse events that they were having due to these individuals feeling safe to speak up. Another study implemented TeamSTEPPS in the middle of COVID due to inconsistencies they were having in handoff between professionals when they were transitioning the care of the patient. So they were able to enact this change in the middle of the chaos of COVID while positively impacting their functioning and communication as a team. Since its introduction in 2006, TeamSTEPPS has had a massive impact in reducing medical errors related to poor team communication and management. Through its four competencies of leadership, communication, situational monitoring, and mutual support, individuals have become emboldened and empowered in order to practice effective communication and teamwork. Standardization of communication is now present throughout many organizations within the healthcare industry that was once fragmented before. Going forward, TeamSTEPPS will continue to be integrated into many healthcare systems and organizations throughout the United States and even the world. Unfortunately, there are many hierarchical systems that are still in place that threaten the collaborative nature that TeamSTEPPS promotes. Instead, these hierarchical systems promote medical errors as well as a threat to patient safety. The continued expansion of TeamSTEPPS will empower all individuals, including its stakeholders. As with many things in life, things continue to advance and change, and the healthcare industry is the same. Right now, the major change going on in the healthcare industry is the integration of artificial intelligence and the integration of telehealth communication and text communication between providers. TeamSTEPPS goals is to facilitate effective communication and teamwork. This is no matter the modalities in which it is delivered. So Team Health will continue to evolve with these changes within the healthcare industry in order to facilitate and promote these goals.